average, every day 115 Americans die from an opioid-related overdose, and more than 1,000 people are treated in emergency departments for misuse of prescription drugs. It's a public health crisis affecting every community and every demographic group in America. AFT members are on the front lines of this epidemic, working with students and families affected by addiction, treating patients, providing recovery services, acting as emergency responders, and researching the science of addiction and treatment. Many of us are also the family and friends of people impacted by addiction, or we may be struggling with addiction or in recovery ourselves. This crisis is challenging all of us like never before. That's why AFT collaborated with Harvard Medical School on this course, which covers 1. How opioid addiction works and why you can become addicted. 2. What an opioid overdose looks like and how to use rescue interventions like naloxone that may save lives. And 3. What are effective treatments for patients and families struggling with addiction and how to access these resources. There are some important points before you watch. First, this crisis didn't come out of nowhere. It was fueled by the pharmaceutical industry's aggressive marketing and distribution of opioids starting in the early 1990s. In recent years, the street market for opioids also exploded, including synthetic versions like fentanyl, 50 to 100 times more potent than morphine. Second, it's time addiction is seen as what it is, a disease. It's not a moral failing, a lack of willpower, or a crime. These stigmas are cruel and scientifically wrong. They've led our country towards blame and punishment rather than compassion and treatment. In fact, a 2016 Surgeon General's report found that only 1 in 10 people with substance abuse disorders receive the treatment needed for recovery. Arming people with science-based education about addiction is a key to reducing the stigma. And third, we must confront the racial bias that shapes how addiction is perceived in America. When addiction affected mainly poor minority populations, as with the crack cocaine crisis, it was treated as evidence of irredeemable criminality. This mentality resulted in mass incarceration and harsh mandatory sentences devastating families and communities of color. Drug addiction became recognized as an epidemic, calling for a public health response only when it emerged as a leading cause of fatalities in predominantly white communities. We must combat racism in all of its forms, including this differing approach to addiction. We have to ensure that communities of color aren't excluded from funds and strategies for prevention and treatment, and that nothing affecting our community and our union members of color happens without them at the table. Our union and our members care, fight, and show up for this crisis, as we have for so many others, because that is who we are as the AFT. Our job as leaders is to provide our members with the tools and supports to do this effectively and with confidence. AFT members have a vital role to play in changing how we think about and treat addiction and ultimately ending this epidemic. Thank you for watching, and thank you for getting involved.